Hello, my name's Ayaz Ahmed. I'm a health improvement practitioner for the Bowel Cancer Screening Programme. I'm here to talk about the Bowel Cancer Screening Programme and the Bowel Cancer Screening Kit. So what is the Bowel Cancer Screening Kit? The Bowel Cancer Screening Kit looks like this. It's a simple test that you can do in privacy and with dignity in your own home. It requires you to provide stool samples or poo on each of these windows. So when you do your first sample, you use the spatula and apply a smear of poo. And you take another spatula and take another smear from another part of the poo and apply it. Once you've done it, you date it, and then you do the next one on the next day, and the next one on the next day. One of the reasons why some people say they won't do the kit is because they say, I don't want to touch my own poo. Well, the kit comes in a self-addressed envelope, and you've got your spatulas. We get asked by a lot of people, well, what's the best way of actually collecting the sample? And it's only from talking to people who've done the kit that we've actually given back those suggestions to people as a way of actually doing the kit and doing it without too much mess. So one of the suggestions is you get a small box. Something like a punnet is very good. You get the box and you line it with tissue paper. And then you put that in the toilet. After you've done your sample on there, you can pick it up, maybe put it in the sink or on the side, and then you can take your samples from there and apply them to the kit. After you're done, you just pick it up and flush it away, and you're left with your box for the second and the third sample. Another way of actually collecting the sample is by making sure when you wipe, you make sure that you wipe enough so then you can take the samples from the actual tissue. We get many reasons for people not wanting to do the kit. So one of the reasons may be that they don't want to touch their poo. The kit ensures that you don't need to touch your own poo. Another reason is that people say, well, when I send it back, I don't want anyone else touching my poo. So when you've done your kit on this side, it's sent off to the lab, who then open this side. And this part here is what the lab will test on. So when I lift this flap up, you may be able to see the light going through. So what happens is they'll apply a dye on here, and if it goes blue, they find blood in the poo. Within 2 weeks, you'll receive your results by post, and your GP will also be notified. What do the results mean? Well, you can have an all clear. That means that there was no blood found in any of those samples. Or there can be an abnormal. The abnormal on the kit means that maybe 1 or 2 or even maybe 3 or 4 of your samples, they found tiny traces of blood in them. A positive result means that they find blood in all 6. This is not a cancer test. This is called the fecal occult blood test. This kit checks for blood in the poo. If they find blood in the poo, it does not mean that you've got cancer. There are a number of different reasons for finding blood in the poo. So for instance, you may have had a nosebleed. You may have bleeding gums. You may have a stomach ulcer. You may even have piles or hemorrhoids. Other things that also may show up blood in the poo is what you've eaten. So for instance, you may have had black pudding, or you may have had a steak which was rare to medium. So any type of blood in any food will also come up in the poo, which will then come up on the kit. So what are the signs and symptoms of bowel cancer? The main symptoms are a change in your bowel habits lasting 3 to 4 weeks. This may be looser poos, bleeding from your backside for no obvious reason. There may be a pain or uncomfortable lump in your abdomen, or unexplained weight loss and tiredness. Who is at most at risk of bowel cancer? Bowel cancer affects both men and women. If you're over 60, it increases the risk of developing bowel cancer. People with other bowel diseases such as ulcerative colitis and Crohn's disease are at increased risk. Diet plays an important part in the risk factors of bowel cancer. Eating more red meat can increase the risk of bowel cancer. If you have family history of bowel cancer, such as mother, father, brother or sister, this can also increase the risk of bowel cancer. So what does the bowel cancer screening kit look for? Well, it looks for blood in the poo, but where does the blood in the poo come from? So this is a model of the large bowel, and what we're looking for is polyps. Polyps are small growths in the bowel that can take a number of years to develop, which may turn into cancer. Polyps can be grown in other areas of the body, but if they are in the bowel, then there is a risk of them turning cancerous. So one of the signs and symptoms of a polyp is small traces of blood, which can then be found in traces of the poo, which is then picked up on the kit. The bowel cancer screening program is for everyone who is 60 to 74 who is registered with a GP. If you are over 74, you can still order a kit free of charge. Ways to reduce your risk. Know your bowel habits. If there are any changes that last 3 to 4 weeks, go see your GP. Increase your intake of fibre. This can help with your bowel movements. Try to eat more fruit and veg every day. Try to limit the amount of red meat and processed meat you eat in your diet. Drink plenty of fluids. Physical activity is an important factor in reducing the development of bowel cancer. Try to do as much physical activity you can. Smoking is an important factor for bowel cancer. If you do smoke, try to quit. Drinking alcohol is also a factor in bowel cancer. Ensure you consume alcohol in moderation. Keeping a healthy weight is important in reducing the risk of bowel cancer. And most importantly, take part in the bowel cancer screening. When the kit comes every 2 years, ensure you do the kit and send it back for peace of mind. So when we talk to people about the bowel cancer screening kit, we talk about the importance of doing the kit and how easy it is. Some people say, well, I threw away the kit. Can I get another one? Of course you can. It's as simple as ringing the free phone number. Do you have a pen? Here's a number: 0800 707 6060. That's 0800 707 6060. You'll be put through to the call centre and they'll be more than happy to send you out another kit free of charge. You'll need your NHS number, or they'll just take your details, your name, your address and your date of birth. So what is Bowel Scope? Well, Bowel Scope is a one-off invite from your GP that you'll get when you're 55. So even if you feel that, well, I'm not old enough to be part of the bowel cancer screening program at 60, you may be invited to a Bowel Scope which checks the lower part of the bowel. So the Bowel Scope is an examination of this part of the bowel. It's a very simple procedure and takes about maybe 10-15 minutes. It's available for people who are 55 and again registered with the GP. The interesting thing about the Bowel Scope is that we're finding more polyps in people who are younger. So at 55, the NHS is finding more polyps than they initially anticipated with the pilot. If you'd like any more information from the bowel cancer screening program for Greater Manchester, you can ring us on 0161 621 7125. We'll be more than happy to send you out any leaflets, and we also do a DVD. This is available in a number of different languages, and you can watch it again in the privacy of your own home and to help you do the kit. The DVD is available in English, Urdu, Gujarati and Bengali.